someone coming up behind me and hitting me, like I'm like checking out for it.
My sister used to do this similar thing, but she used to like karate chop people in the neck.
That's different.
Right? We could.
Look how excited she is to be sponsored by Blooms.
That would be everything, honestly.
You would love that.
I tagged them in my stories to try and get them to
Blooms.
repost it.
This is the hardest working, most hustle-oriented person I've ever worked alongside. I call her Mighty Mouse. And all she runs on is Blooms every single day.
It's true.
Sponsored.
Raspberry lemon, specifically.
Please. Thank you.
Yeah.
And it's also why she has TMJ problems. Hey everybody, this is Dr. Warren. I'm a chiropractor here in Baltimore, Maryland, and I like helping people out with a lot of different problems. One of those problems that I see often in the office is Temporomandibular Joint Dysfunction, TMJD, or TMJ, as people call it. Okay, let's see. Night guards oftentimes are prescribed early on by your dentist, which help protect the teeth. And maybe in some cases it provides some functional relief to the jaw, but most often it initiates the bite even more, and people wake up with soreness in their masseters or their jaw. Oftentimes when you have temporomandibular joint dysfunction, or TMJD, it's usually unilateral in pain and presentation, but functionally how we address it, it depends on where they're stiff and where they're, we'll call it hypermobile, or the noisy joint. And so when you wear a night guard over and over again, it might present in a certain way, of like stiffness on both sides or trigger points in the muscles on the side of your cheek. And so every case is different, is basically what I'm trying to get at. And then we do a lot of things that help but don't often get to the root cause. That's probably the oldest but truest story that I hear about all different kinds of ways. Like getting your energy from a can of Bloom. Yeah, right? But I get it. Oh, I get it. I was like, we had one espresso worth of coffee left in the house this morning. My wife and I were like
fighting. Yeah. Wild West style.
Wild West style.
Yep.
And I made it, and it was perfect. And I took a sip, and I was like, honey, I'm gonna share this with you. She's like, you damn right you're gonna share that with me. She's a little bit pregnant right now too, and we got 3 kids, so she definitely gets the most of that cup of coffee.
Sharing was wonderful of you.
Share your Blooms with us next time. Can we scooch on up a little bit for you? All right, so real quick, I'll show you how I do some work on the jaw, or we can just sit and talk about energy. No, we'll get to work. Okay, so do me a favor, open up. I'm gonna look for least and last with her, okay, which I see on the left side. Oftentimes I'll correlate that with some neck issues as well, but I'm gonna get right to action here. So go ahead and open. I'm gonna work on her pterygoids. You can close. And we're gonna do a little bit of muscle release, a little muscle energy work in the back, myofascial release, a lot of different names for it, just depends on what your profession or title is. Open up for me. Good, I'm gonna hook right into this tendon right there, okay? It might be a little tender when I get back into it, okay? Open up wide. Good, and close. All right, we just get things rolling here. We'll do 4 reps. Go ahead. And close. Do it a little slower this time. Pop me off you. Go ahead, go. There we go. Little tender spot right there. I want to hang on that for a second. Close. Open. Good. Cool. Now let's go round 2. Close. Alright, it's just like any joint. I'm going to look at it from a lot of different angles and directions and movements. I'm going to address some of the structures around it. And then functionally, I'm going to think about like, why is this happening? Right? Is it a mechanical thing from the neck open and shoulder? Or is it Blooms? Close. I know Nicole. It's probably a little bit of both, but probably more on the Bloom side. Open. Either way, I can make a local effect to affect a systemic change in the body and still provide her with a lot of relief and a little happier of a jaw. Close. But if I ignore the other side of things, then open, I will just keep running this problem, and we'll go crazy in here. Just keep repeating the problem over and over again. Open. There you go. Close. All right, open. I could spend like an hour working on someone's masseter jaw and all the muscles to it. Save it. I'll show you a little bit of a light. That's pterygoid work in the back of the mouth, going on the tendon, doing just opening and closing. Don't have to do any deviation from that position, but I will go and I'll affect those muscles that help deviate the jaw in just a second. Go ahead and open up for me nice and wide. It should feel a little bit like nicer already.
Yeah, it doesn't. I don't feel the popping as much on the left side.
Nice. Go ahead and open for me. And then I'm going to put my thumbs right down on her molars, down gently, close, don't bite my thumbs. And you're just going to feel your muscles engage. And then just go ahead and open up wide. Good. I'm going to do a little gentle stretch. She has such a, honestly, smaller mouth, so that I'm just going to go ahead and do it from the bottom here. Go ahead and open. Gently close. 2, 1. And open. I'm going to stretch you a little bit, okay? And I'm going to palpate. Just relax for me. There we go. So I'm going to palpate the joint as I'm rolling back and forth. Good, and relax. Go ahead and open again for me, nice and wide. And close, cool, I got you. And then open. And then relax. Let it fall down here for me. You're gonna feel a little stretch on the left side of your cheek, like through here. So let your jaw hang. Open and hang. Carly, you come on over here. I'll show you what I'm doing. I'm pushing her chin down to here. She's still kind of like the jaw, it's so hard to relax your jaw. So she's not there yet. I want you to think about your chin coming to my thumb over here. There you go, perfect. Now she just dropped in this place. Now you'll actually feel a stretch. Good. And then push your chin into my finger that is pushing on you. Not to Carly, more to my hand. I know it's a hard one. This hand right here. Yeah, good. But don't kick your chin out so far when you do it. Just go straight to the left. It's hard. Good. And then relax. So a tight muscle is hard to control. It feels, and there you go. Good. Now let it fall back down to where it was. Oh man, you got it. Good. You're going to feel a stretch down on your cheek here a little bit, okay? And so my hands will move pretty quick here for this. This is an adjustment to the TMJ joint. And her occiput on her right side. So let your body fall. Good.
That was good. Oh, delicious.
Okay. Talking about balloons or that adjustment?
Both.
Cool. Okay, so then I'm going to go ahead and repalpate. Open for me, nice and wide, and close. Good, I'm going to do a good big stretch here. Open nice and easy. Good, and close. Open. Close. Good. I'm going to push straight down. So open your mouth a little bit for me, and I'm going to just basically gently glide the joint backwards, and you're going to push up into my hand. Perfect. Oh my God, perfect. And then relax. So excited for you, how well you did that. Feel like, push up again. Really good. And relax, gentle stretch here, yeah? So relax it open, and let me just glide you down. Good, push up. And relax, let it glide down. Good. And go ahead and open for me and close. Good. We're going to come over and hit these pterygoids and masseter, open up wide and let it drop to the left. It's going to be a little hard. harder to do on this side. Push your jaw to the right. Good job. And let it drop to the left. Big stretch on that masseter right there. So I just hooked my heel of my hand down across, just in front of her mandible, coming off into a trigger point in her masseter. I'm just putting a little feedback into that to get it to relax. And a really nice healthy stretch there. Good. Okay, let's do that again, hon. Go ahead and let your chin drop. Good. Push your chin to your right. I'm going to stretch you after you let it go. Ready? 3, 2, 1, relax. Good job. Good. You're going to feel a little release here, okay? Nothing too quick. Good. Now open for me. Good. Close. And relax. A little release there and there, okay? Good. Open up for me. And close. Good. Alright, so we just did... How does your jaw feel, by the way?
Amazing.
Okay, so we did some masseter stretching, more like a pterygoid side glide. The chin straight back is a form of a Mackenzie stretch on the joint itself, so I'll teach you how to do that, kind of to create a little bit of a stretch on the capsule, see if it helps alleviate some of her tension and stress there. I've been working on her neck. You've seen me adjust her neck, doing some manipulation there relative to where she's restricted in her joints, but also there's probably a little association with being tighter along this region of her left side of her neck and jaw, and I'll work on that. Relative to all of that, in conjunction with a little home stretching and return, I'd probably see her, because this is my first time working on her jaw, twice a week for 2 to 3 weeks, see how she's doing with what I gave her and what I'm doing to her, and I should see start a pattern unfolding and changing during that time, ideally, especially if she's kind of limiting some of the factors that create some of that stress pattern as well, okay? I've been treating her for a little while in her spine, her upper back, her neck, and her lower back periodically. She's a tough cookie to crack, literally, relative to some of the adjustments, so I had to kind of change things up a little bit with her. Even though she don't look like she's tough, correct? So I'll show you how I do it. Create a lot of flexion here. Tuck your chin. Good. Good. And then rest. I'm going to bring you on up. You're going to follow me. I'll show you how I do an adjustment. So full spine adjustment for it right now. You'll get to see that as well. Come follow. Nico, you can sit right here and put your feet up top. Here you go. Easy. Come down. Good. Relax your shoulders. There you go. And then interlace your fingers for me. And go to Cabo. Relax down. Easy. So I'm going to create pressure over your TL junction.
Oh.
Awesome. Good. So interlace your left. Come follow me. TL junction. So lay on your stomach here. What I was saying was where I was adjusting her is where her thoracic spine meets her lumbar spine. Just in that junctional space in flexion. If you're wondering. And there are some that wonder. Alright, now you get to relax. Look forward for me a little bit. Relax your shoulders. And get comfortable. Get your necklaces out of there.
It was the mic.
You good?
Yep.
Okay.
I was really sore out there today.
Been lifting more, haven't you?
I have been.
That's awesome.
Today my glutes are on fire.
Did you do a hard workout over the weekend?
Yeah, yesterday.
Good for you. Keep getting it. Stay in it, girl. There you go. So, we've got 5 chiropractors that work here, and we have a massage therapist, 6 technically, 6 chiropractors, 1 part-time. We have a nurse practitioner, a couple other interdisciplinary practitioners coming in to join us in the next month, which I'm excited about. But the people that keep the office moving, patient care dialed in, and really supporting a lot of us in terms of what we do from a practice standpoint. People like Nicole, and the 7, 8, 9 sometimes other wonderful people that help keep the flow of this office going and supporting our patients.
When you press on this side,
Yeah?
my elbow gets tingly.
Yeah, you got a little trigger point right here.
Oh, I ain't never felt that before. Right there is okay. It's a little higher. It's so weird.
So I like to take care of them, is where I was going.
Oh.
And I'm happy to do that for them on our lunch shifts. But that's what you're seeing right now. This is someone that works in my office. Probably didn't explain that. And she does a great job of helping us and supporting patient care. Does a lot of the modalities in the office for our patients.
Yay.
Oh, we'll keep it nice and smooth. Lie on your side, this side up for me. Please, thank you. And thank you for what you do here, Nicole.
Oh, of course.
There you go. Rest.
Oh, that was beautiful.
I'm on your side, face that way for me.
Whew, that was a good one.
Good. Back.
Yeah, it's that glute. That one hurts.
Let it fall.
Oh,
Back. All right, so we've talked a lot in terms of what she's been doing, movement-wise, fitness-wise, routine outside of here. From a treatment standpoint, I'm gonna start focusing on her. I'll help you out a little here. Her jaw and her upper cervical spine. Work on trying to find some balance and some of that deviation and some of that clicking, popping, but a lot of just general stress in that area, which will help a lot with some of the pain that she feels. I see a lot of TMJ problems come in the office. A lot of people think that you can address them, but it's like anything. It's like an area of stress and pain in a joint and muscle that can be affected through some of these services, right? Really commonly. As well as some course correction. Keep course correcting. Take care of yourself. Feels good, doesn't it?
mm-hmm.
Sweet.
Well, you could stay here for all day. How about you? Oh my God, like it's burning, but it feels so good.
Take a breath and relax.
You saw me rolling my hip today.
Today, dude?
Yeah.
While you're working? You got that foam rolling? Oh, against
remember?
the wall.
Yeah, you saw me with the ball.
Yeah.
Oh my God, it's because I was doing a laser and I was like leaning and I literally felt my whole glute start to spasm. I was like, no, not right now. We got too much to go.
So yeah, that massage ball is kind of a little tricky. A nice little
I
trick
have
to
one
in
at
the bag.
home that I've been using, so luckily that's been nice, but
Yeah.
today it was just on fire and I did that laser. Oh, I was like, I don't know if I can do that again. I had to roll it out. Oh. How you crack my fingers and I don't cringe is crazy to me.
Why, that usually bothers you?
Yes. My friend used to crack my fingers in middle school and I used to almost cry every time. I hated it.
We're circling back on that trauma, don't worry.
Yeah.
Got you.
And it's not even that it hurt, I just don't like cracking my fingers. I'm not one of those people.
Man, I used to play this game in middle school and elementary school, where you would just, it was like Frogger or something like that. You just tag the person on the back of the elbow with your knuckle, just like a punch.
Oh, and it jolt them?
Yeah, you jolt them.
That's hilarious.
But like, it was a thing for like 2 years. And like, I still feel like someone coming up behind me and hitting me, like I'm like checking out for it.
My sister used to do this similar thing, but she used to like karate chop people in the neck.
That's different.
Right? But like all her friends were doing it too. I'd go pick her from school and I'd see them doing it. I'm like, oh, you do this?
Yeah, it's weird.
I guess they got more vile as the generations got older.
Yeah, it's karate.
Karate chopping people in the neck. I don't know. Yes. We just used to play tag.
Oh, I feel you. Yeah, have a good shift off. You're welcome.
That's great. Well needed.
Thanks for watching, y'all.
Thanks for watching, y'all.